morning and welcome to this edition of The Big Story on Morning at TV. It's the 23rd day of April 2015. My name is Simon Kasiate. Do you remember that about 5 years ago, government went out of its way piloting a project to give some 25,000 Ugandan shillings every month to the elderly? Scratch your head a bit hard. Yes, 5 years ago, through the Ministry of Gender, Labour and Social Development, government thought it important and imperative to take care of the elderly, especially those who are facing dire financial situations as they grow older, much longer after their useful time in terms of work. And so government went out of their way to give them a stipend, 25,000 shillings a month, and piloted this in a couple of districts across the country. 5 years down the road, can we still call that a pilot? Or can we say it was affirmative action, but biased towards those very districts? Are we getting to a phase where government is evaluating and thinking this is a project that actually works? Or this was simply a drop in the ocean, or we can't afford, or this simply does not work and propels a dependency syndrome? All that and lots more is what we'll be discussing on The Big Story this morning, just to jig our mind on how well-meaning, highly involving government projects many times go to waste because of lack of follow-up. We'll be right back. Alfred Nuwamanya is the head of programs at the Ugandan NGO, National NGO Forum, and you are specifically looking at the docket of social protection in Uganda, and you are one of those who's closely keeping an eye on this social protection intervention the government put in place to give the elderly some 25,000 shillings a stipend. Let's start from the spirit. Is that the way it should be? Or we should leave it the way it has always been, that residual help for the elderly is always a preserve of their immediate family?
Thank you very much, Simon. I think that's the way it should be, especially in light of where we want to go. I think the nation is being marshaled towards the Vision 2040. We are talking of a move from a peasant society to a modern one. Now, you don't talk of a modern society where, again, you are relying on peasant aspects of that society where people have to live with their parents and their grandparents caring for them. That's not modernity. So in that spirit,
modernity means we lose humanity and act like animals that never take care of them.
Modernity means we have systems that guarantee dignity for all people irrespective of where they live.
How more dignified can it be if you're staying with your grandmother and taking good care of her, as opposed to her living in an elderly home run by a competent government, even if it was in the US?
Actually, we are not advocating for people being shifted into homes and herded there, because that then would be in conflict with our cultural norms. What we are advocating for is that the economic conditions will force Simon and Alfred to be at Serena, not in their respective villages where they were born, taking care of their grandparents, but that they have the assurance that there is a system, a robust system, that guarantees that their grandparents have at least a way of life, the basics in life.
Like sugar, salt, and all that. 25,000 shillings a month. How much of that really can be called dignified?
Well, I think that's a very important point you raise. Many people have actually said this is too small. But if you ask the Minister of Finance what we are struggling with, they are saying actually it's too much. Minister of Finance, irrespective of a 7% growth, they are saying the government may not afford 25K per month for people who are 65 and above. And yet they are not many.
I hate going personal, but let's look at the Permanent Secretary of Ministry of Finance.
Yes.
The good, amiable Keith Mhakanis.
Yes.
If Keith were 65 and someone was giving him 25,000 Ugandan shillings a month, how much would he do for himself in a dignified manner to deserve that?
I like that, but let's also not forget.
He's talking about the fact that
let's not forget that
it's coming from
we have a few permanent secretaries against the backdrop of 38 million Ugandans. So how many cases do we have? And that's a fundamental issue that we are looking at. Now, we in Uganda, we are facing something very interesting. There is tremendous economic growth, but there is also deepening poverty. They are all running concurrently. Now, to those who are really...
It's not only in Uganda, even in the US.
But if you look at our Gini coefficient, it's really a bit strange. I mean, we are not the worst. Rwanda is actually beats us in that, in the disparity index. But that's something for a concern. Now, when we are moving around as NGO Forum and as the civil society, a certain retired ambassador in Mbarara, who heads the Association for the Elderly, challenged us, those of us who think 25 is more money, and said, how many of you give your parents, your grandparents, your aunties and uncles, every year 300,000 shillings? Every year, and you can say for the last many years, I've been giving them 300K every year, and we all looked down. That then made the point that 25,000 is not small money if it is regular and guaranteed.
Tell me something here, Alfred. This pilot has gone on for 5 years.
Yeah.
In a select number of districts, and in fact, we're talking about 15,
yeah,
against a backdrop of 72. The last I checked, 112 districts.
112. So 97 are not serviced.
5 years?
Yeah.
What is the result in your view? You think this has been working and therefore government should expand it, or the 15 districts have only benefited from affirmative action?
I think the studies have indicated that it's affordable. And let me quickly say that if there is affordable, yes, there are studies, and these are government studies done by consultants hired by the Ministry of Labor, Gender, Labor and Social Development. Let me just say, if there is any one government project that has really passed the test of time in terms of good implementation, in terms of making impacts, it's this program called the Expanding Social Protection. It had two streams. Now, the way it was constructed was that you would go to families and check those families that had labor constraints, like people with disabilities, like those who could not fend for themselves.
And even lazy ones, I'm sure.
No. If you had the labor capacity but you are not utilizing it, they wouldn't count you. So those were given the vulnerable families grant, again at 25K. But then there were those with the elderly. 65 years and above, and 60 for Karamoja. Specifically, because in Karamoja they say reaching 65 is very, very hard. So
if you make it
60,
well, life has beaten you so much at 60
at
that
60
you have the way and the tail.
Yes. So in Karamoja it is at 60. So now they piloted. In one sub-county they would do the senior citizens grant, in the other they would do the vulnerable families grant. Evidence has shown that the senior citizens grant is actually very clear. It's very easy to understand. The community appreciates it, and therefore, and it's very easy also to verify that, you know, somebody is 65, somebody will look at you and say, I studied with Simon, he must be 1 year younger than me. Since I'm 70, he's there for 68 or thereabout. So it's very easy. And I think the evidence has shown that we don't actually need to divert even resources from big sectors, because the argument has been, if we are to pay the elderly, then it means we have to compromise the roads and security,
health.
The research has shown that what we need to really focus on is the increase in the revenue collection. So if we say, let's maintain what we are collecting 2015, and we look at URA collections and projections 2016, and we just mark up the increase and get a 6% of that, of whatever increase will be there, it's enough to finance the senior citizens grant in all the 112 districts. So it's affordable, it's very easy to implement. By the way, we don't have government
How can it be easy to implement?
Well,
Alfred,
yes.
when? For a few deserving pensioners, where there's a system in the Ministry of Public Service, the disbursements of these pensions went the way you and I and the viewers can aptly remember. And these were just a handful, remember? Compared to the rest who are above 65.
Yes.
Don't you think this creates another avenue or a window into the blood bank for Dracula to enter in there and take away its liters and liters of the much needed blood?
Yeah. Interestingly, the good news for this particular program is that it doesn't go through the government system.
Oh,
yes.
Educate me.
What happens is that money is released from the treasury to a financial manager.
Who is autonomous of government?
Yes. Yes, yes. And then it's transferred to the beneficiaries' SIM cards. It goes through MTN. So you just receive your money. You don't have to line at public service. I worked in public service for your information, and would always see day in, day out, all the people lining, and sometimes you really feel sympathetic. Dehumanized. Following up not only their money, but their also children, their files, but all sorts of things. So in this case, in this senior citizens grant, once the release comes, it goes to the fund manager, and then immediately the schedules are given to MTN, and MTN gives money to these people's SIM cards. They are special SIM cards, and then on the payday, if you want cash, you go to the pay point, and MTN gives you the cash. The way you go to an MTN point and draw money from
at a good charge, I'm sure.
Well, the charge is not borne by the beneficiary. The good thing. It's part of the design that the government will meet the cost of withdrawal. So it's fundamentally very, very, very effective.
You sound very optimistic, and this is a very good piece of information coming from civil society about a government project. Normally you are always against them, considering them to be ill-conceived and unable to meet the standard. And I am told reliably today you're having a conversation or a dialogue between the different stakeholders to try and push government to fast-track the implementation of this beyond the piloted 15 districts. What's the level of, I know you're a very optimistic person, but you think everybody's going to come on the table, especially government, to do this, especially now that they cry foul to the extent that they don't have money?
Well, I think the purpose of the dialogue is exactly that, to try and exchange views, because we are having mixed signals. On one hand, the government own commissioned studies are showing government can afford, and the government doesn't have to struggle. But on the other hand, you see the reluctance and the...
Have you considered the risk, the perception risk, if, for example, this is adopted now, that people will think you are doing yet another move to bribe people, especially ahead of an election?
I don't think so, because this pilot started 5 years ago, like you rightly said, and in June it will end. And now the issue is, so what happens even to the 15 districts if this ends in June and there is no successor program? We were in Zombo, and an old woman was asked that question: what would happen if
this money stopped coming?
And she said, oh, government would have killed us. Now, we don't want those people to say they have been killed. Again, we went to Arua, and somebody said, oh, it has been raining in Zombo, it has been raining in Nebi, it has been raining in Yumbe. Arua, no rain. Now, this was an elderly man. No rain in Arua, no rain in Maracha, no rain in Koboko, meaning that they have been seeing their colleagues across. Getting the money and doing so many things to themselves, and yet for them they are waiting. We have just finished a countrywide consultation. We have met groups of elders and government officials, RDCs, CAOs,
and everyone is behind it.
Everyone is saying this is actually long overdue.
And I hope that they won't ask for retrospective payment over the last 5 years.
No. They know that this is a pilot. Let me just quickly say about the fact that it's coming to an election here. In the dialogue this morning that we are having actually here at Serena Victoria Ballroom, we have invited all the major political parties.
So that they can
also give their views. If they were, because I mean, we are not predicting, if they were to be the ones in the government next year, how would they roll this and how would they run with this? So specifically, invitations were sent to FDC, to UPC, to DP, to CP, to JEMA, and Federal Alliance.
Good luck on whether they will attend.
If they don't attend, that's their problem. But you see, I think we have to reach a level where everybody, both in the government and in the opposition,
can sit on the same table and discuss.
Sit on the same table and discuss national issues.
Alfred Nuwamanya, Head of Programs, Uganda National NGO Forum. It's been a pleasure having this discussion with you, especially that we're talking about where you and I are headed to be 65 and above, and I wish this comes sooner than expected, so that I can start earning that stipend from government, especially long after I'm unable to wake up early in the morning to partake of some of these activities that earn me a little bread here and there. Let's take a short one. When we return, it's Simon Says. Well, all of us are headed for old age. The debate on the table is whether in our old age we will enjoy our life with dignity, we will at least be able to afford life's little basics, and will be taken care of even if we do not have a strong residual family system that takes care of ourselves. And this is when the buck comes back to government. Government was well within sensible thinking when they decided that elderly people of a certain age market should be given a stipend of that amount of money per month. Of course, arguments are rife. Is 25,000 shillings really up given the standard of living? But I mean, it's 25,000 shillings more because many of them do not even have it. Many of us who possibly will be fending for these old people are busy spending what would otherwise have made a difference in their lives in things that many of us would not even want to discuss on open air like now. And so when government comes out and pilots this program, it is welcomed by some quarters, but also there's now a challenge. It's been 5 years. You're still in 15 districts. How about the rest? There are 100 and so other districts which you've not yet come to. There is always need to ensure that some of these pilot projects are given a specific time limit from which they can either be stopped or expanded. And this particular one is a clamor to expand and reach every elderly person in this country, if for nothing else, at least to achieve the key objectives for which this program was started, which is, of course, the social protection, so that people do not die earlier than they should have because of desperation and the need for little life's basics. We cannot necessarily work and be productive, those of us who are still within the productive age, because who knows what will happen tomorrow. But also we should be relaxed in knowing that a government will certainly be in position to take care of us when we are a long way past our useful, energetic times on earth. And wherever it is that we are, let's go make it productive. Let's pay our due diligence to the state in terms of paying our taxes so that they have no excuse to say there is not enough to cater for our elderly time when that time comes. Have a good morning.